Patient DM is a 42-year-old male presenting to have his Mantow TB test read. His TB test subsequently read as over 15 mm in duration. Basic metabolic panel, liver function, HIV, and HCV tests were all done as well. Metabolic panel showed all labs within therapeutic range. HIV and HCV tests both came back negative. Patient has no known drug allergies, past medical history of generalized idiopathic epilepsy, and social history of alcohol use. The patient does deny fever, dyspnea, hemoptysis, and cough, but did just return from a family trip to India. Chest x-ray showed no lesions or cavitations. The diagnosis of latent TBI, based on the lack of symptoms and risk factors, the normal chest x-ray, the Mantow reading over 15 mm, indicated the presence of an infection but not active TBI. Due to the latent TBI, the patient should be initiated on isoniazid 300 mg per day for 9 months to decrease the risk of developing an active infection, and this should be administered on an empty stomach. This can cause neurotoxic effects due to the increased elimination of pyridoxine, vitamin B6, so supplementation of vitamin B6 50 mg per day by mouth would be helpful. Carbamazepine ER 300 mg, 2 tablets by mouth twice daily, should be continued in this patient, and their levels should be assessed in 1 week. Carbamazepine has a therapeutic range of 4 to 12 micrograms per milliliter. Isoniazid will increase the exposure to carbamazepine, so the doctor should be contacted if experiencing ataxia, headache, vomiting, drowsiness, and confusion, as any of these may be a sign of carbamazepine toxicity. Patients should discontinue any alcohol use, as well as acetaminophen 325, because of the increased risk of hepatotoxicity from both. The patient may take ibuprofen 200 mg every 4 to 6 hours if needed, but should limit this as much as possible. Calcium carbonate should also be discontinued because it decreases the absorption of isoniazid, but if needed, it can be taken at least 2 hours after isoniazid dose. This patient will be discharged home, but should return to the clinic in 4 weeks for LFT and carbamazepine blood level monitoring. After this, their LFT should be monitored monthly. The patient should also follow up with the neurology clinic for examination. Thank you very much.